Now, in previous AGMs, I'm pretty certain someone actually did this already. They put strap lines up and said what were the organisations. I'm sure someone's done that before. I think it's an idea worth reiterating, because I think it does give a flavour of the organisations and the ethos that they work with. There should be at least 4 here. I couldn't get from Salford University a strapline. They're going through a rebranding exercise and saying that a University of Greater Manchester, which is, I think, very contentious locally, but we do a lot of work with Salford University. Can anyone hazard a guess at what the last on the list of which organisation that is? It's Manchester University. And we do an awful lot of work with Manchester University. We've got a partnership with them and with North West eHealth with Salford Royal. We're looking at public health data analysis. We're looking at pathway analysis. We're looking at bringing research into the city. A massive amount of ongoing work. Again, Hundreds Health Salford, piggybacking on the relationships started off by the PCT. The top one, safety and personal. Tony Whitfield, you can't answer this one. That's the Director of Finance, SRFT. Yes, it's Hope Hospital, isn't it? Massive amount of work going on at Hope Hospital. Elaine Tamkin, colleagues from the PCT management team, similar colleagues from the management team in SRFT, A&E consultants, an immense amount of work going on in redesigning unscheduled care. That sounds, well, we just do that in Salford. But outside Salford, it doesn't happen. That kind of partnership doesn't exist. GPs, PCTs, local authorities at hospitals are at loggerheads. That is not the case in Salford. Middle one, my life, my support, my choice. Local authority social services, personalisation agenda. Huge amount of work done on the local authority, the place law, to improve life chances. And perhaps the one nugget in the white paper and the ensuing bill, the Health and Wellbeing Board and the migration of public health to the local authority. Alan's mentioned the challenge, and it is a huge challenge because our colleagues in the local authority have been in receipt of huge swinging cuts. Be that as it may, this is a real opportunity, the first time in my professional lifetime, to really start looking at the determinants of ill health, the causes of ill health that we can't sort out. The Marmot report says quite clearly the GP's prescription pad, the surgeon's knife, cannot sort out a large chunk of ill health. It's poverty, it's worklessness, it's poor educational attainment. All these things, behaviour. These are things that the Health and Wellbeing Board has got a real opportunity to influence. And I think feeding into the Health and Wellbeing Board is Health Watch, the conduit, or at least one of the conduits, to get our public to speak to us. Oh, this is in colour. This was a picture taken yesterday. It's got some of the GPs, and some of the execs, and some of the commissioning managers for the PCT. Some of these GPs will present themselves and neighbourhood partnership boards, another conduit for our public to start speaking to us. I quite like this picture. I just realised that red is a really good colour for me. It's not just because it looks nice, well I think it does, but it also is very, very good at hiding the Stedman abdomen. Why should a middle-aged GP want to bother this audience about his tummy? Well, I live in Salford. My father, my dad, died as a result of illnesses caused by being overweight. I carry that risk as well. But it's only me that puts food down my throat. So why is it of interest to this audience? If I get ill, it's not only me that suffers and my family, but that means money will be spent on my care that otherwise could have been spent for the care of the rest of the people in Salford. And I think we have to start having a discussion about what we think we individually have to do, what we contribute to the greater good of everyone, and what is actually a responsibility of an individual patient. And that's a very difficult discussion to have, but we have to start doing it. We have to develop a partnership with the people of Salford. We have to understand what the people of Salford want. That's a really difficult discussion to start having. Local authorities up and down the country have tried to drive up the number of people coming to local authority elections. 1 in 3, see 1 in 5 people eligible to vote turn up. Everyone in this room is or will become a patient. The health service is important to every one of us. We have currently a system that is free at the point of delivery, but we have a finite pot. So we have to come to some consensus inside about what we think the health service can deliver. Medicine can deliver an immense amount of things these days, but it costs money. So what is the standard of care in Salford that people expect? And what is the standard of behaviour they expect from each other? Because once we start doing that, we can have a promise from Hamish Health with our population to where we go from here, a compact if you like. And I would suggest that we move from the strapline that the PCT used, and I'm not sure, I always think it's the other way around, but anyway, I put it this way. Instead of just saying, adding years to life and life to years in Salford, I think it's helping people to do it, because it's people that do it. We can't do it for you. No one can make me not eat that food. Well, my wife can, perhaps, but no one else can. So it is important. This is my last slide, a bit corny. First thing, to make sure I don't become as portly as this cartoon character. Change is really scary. It is very scary. It's scary for people here because they don't know about their jobs. It's scary for people because they're unsure about the capabilities of a new organisation. It's scary for the local authority because they haven't got enough money, nor have we, but they've got even less than we have. It's scary because we have new roles and new responsibilities, but we have to deliver it. So it's challenging, hugely challenging, with the financial backdrop we've got. I'm not sure change is fun is right, but what I would say is this. The people who work in Salford are deeply committed to Salford. We have to retain the workforce that works in Salford as much as possible to deliver because of the local relationships, the local knowledge. Clearly there will be some economies of scale, but we have to do our utmost to retain as many people with the local knowledge and commitment that we can. Clearly boredom is not an option. Alan and Mike before him mentioned the legacy. We've had a fantastic flying start from this Salford because of the PCT. We dare not, we must not squander that. Surely the legacy should be adding life to you, or helping people add years to life, helping people add years to life and life to years in Salford. That would be the real legacy if we achieve that. Thank you for your attention.